A goal in clinical trials is to understand very quickly whether a therapy is effective. And one of the big unmet needs in multiple sclerosis is a fluid biomarker of treatment response that we can use to both evaluate new therapies as well as to evaluate our patients on current therapies to see if they're working. A very exciting biomarker that's currently under study is neurofilaments, and a particular neurofilament called neurofilament light. Neurofilaments are the scaffolding that comprise the internal structure of neurons, the cell bodies and the axons. And when the neurons are damaged, the neurofilaments will be released, first into the spinal fluid and eventually into the blood, and they can be measured as essentially a body count of the number of neurons which are injured or damaged from multiple sclerosis. Now, neurofilament is not specific to multiple sclerosis, so anything that injures neurons will lead to an increased level of neurofilaments. That could be traumatic head injury, a stroke, other degenerative diseases like Alzheimer's disease and Parkinson's disease. Basically, anything that injures the brain or the spinal cord can lead to a spilling of neurofilaments into first the spinal fluid and eventually into the blood. Recent analyses have used banked blood from clinical trials to understand how our therapies impact neurofilament. And what we found is the therapies that decrease active inflammation in multiple sclerosis also decrease neurofilament. We would prefer to have this biomarker from the blood rather than the spinal fluid because it's much easier to access the blood. And indeed, our anti-inflammatory therapies have shown great effect in reducing neurofilaments in the blood, and suggests that we may be able to use neurofilament not just to evaluate new therapies, new anti-inflammatory therapies, but also to follow our current patients on their anti-inflammatory therapies to detect how well they respond.